So the imbalance will be on the respiratory system, on the emotional aspects, skin disorders, phlegm, or everything which is connected to respiratory, and the mucus. And also the connection of tie-in here is we can see that with spleen and lung, the layer that is responsible for creating chi from the breathing and chi from the food. So, okay, lack of vitality. Again, if a person, just for demonstrating, a person who has weak lungs or weak metal, the ability to inhale is quite low when the organ is weak, because when the organ is weak, the shoulders will tend forward or down, and the ability to breathe, like to take a deep breath in this condition, is quite difficult. So one of the trainings to give them is just to take the shoulders back, to open the chest, and to take the thumb back. I will just show it on one side, to take the thumb back, and like both hands, okay, and just inhale and exhale, like to work on the breathing and to practice it even 5-10 minutes every morning. In the evening is also good, but especially in the morning. You know, Chinese, they go to the parks to do Tai Chi at 3 a.m. So early in the morning, it's good to do that. But anyway, whenever they wake up, working on inhaling and bringing the chi in, and then to spread it with the breathing. So lack of vitality because of deficiency of oxygen or chi that comes from the outside. Okay, stiffness in the spine and neck also is connected to this posture, okay, when the lungs are weak. Okay, I will just show it from the side. It's like that. Okay, and then they have neck issues also. Actually, one example that I have about a patient from like 2 years ago, I think it was, young guy at the age of 73, who came because of neck pain. And on the first time I saw him, I saw that in his I will open. Never mind. Just one more minute. So he opened his mouth, he showed me the tongue, and I saw that on the area of the lung, there's puffiness, like the lungs are jumping out, like screaming, we want out. And he came for the neck. But then I started asking him if something happened that makes him like something sad, or if he's on grief or something. And he looked at me in a surprise, because this was his first time that he came to acupuncture. And he said, actually, yes, 5 or 6 years ago, he said, I lost my only child, my only son. He has daughters, but he lost his only son. And he took it really hard. And since it happened, the grief made him to be with himself, like inside, and the energy couldn't move because everything was blocked. And he didn't communicate with people too much. With his wife, he barely talked with his wife. And I told him, just do this stretching and do this just to open the breathing. And the acupuncture I did, the treatment was mostly working on the lungs. I didn't work on the neck at all. And the week after he came, and he said, it was an amazing week. And I suddenly, he said by himself, I didn't know that before, that he didn't communicate with others. So he said, I was really relieved from what you said, and you said the connection might be to the grief I had, and because I told him, you can't go back, you can't go back on time and bring him back. So just release, let's go and continue with your life. You still have daughters, you have your wife, you're still young in comparison, so you can still do things. So I gave him like a motivation conversation, like, okay, what happened, just look at the future. And he was really relieved with that. And he said that on the first time in a few years, the rabbi in the synagogue shouted on him that he's not stopping with talking. He talked with and his wife, he talked with his wife suddenly, and he was really like open. So it was really amazing to see that. Of course, the neck was better also. We work on that too, but I saw him for like, I don't know, 4 or 5 treatments, and he was fine. I mean, the main complaint was treated. So anyway, the ability to look on the patient, to look at patient on the whole point, like in the whole way, it's very important. And this formula is basically representing that. Now, you will see that all the actions are connected to dispel cold and warms the middle jiao and spleen and stomach, tonifies qi. It's most of it goes for the for spleen and stomach, but some of the syndromes will be connected to tai yin, basically. But the main thing that I love this formula is the ability of the formula to express emotions. And I didn't give that patient herbs, but I think it would have helped to take this kind of formula, because again, all the cold pathologies which the formula treats with Ganjiang and Renshen and Baizu, strength the spleen, and dries dampness, it's all connected to moving the qi in the abdomen or in the middle jiao, but also something that I see in the clinic. I'm not sure that all the indications are showing the support in what I'm saying about the emotional aspects. But so this is like, you know, the common indications for this formula. But in the clinic, because of what I remembered about this formula, that it's helping to express emotions out to the outside and to act on the outside. This is the main thing that I want to achieve about when we talk about the metal, the yang aspect of the metal, to all the movement that goes inside, I want to release it outside. So this is the main indication. So I hope I'm not confusing you with a formula which mostly regulates the middle jiao, digestive system, but the chest fullness and pain, I will consider that as one of the symptoms which I like about the connection to this formula. So the main idea is just to express, to let go, to have the ability, instead of being inside, everything blocked inside, just to let go. And we can do that through the digestive system quite well also, but because of the warmth of the formula and the strengthening of the qi. Okay, just a fast look on the questions. Okay, specifically about, I go from the last question and go up. What about slight depression in the nation on the tongue in this area on the patient's left side? So, well, again, the photos of the tongues are mostly to present specific conditions. So when it's marked, so the main idea is to look at the circle. We can see other symptoms too, but I want you to be focused on the specific part that I'm mentioning here. So I would consider this area as stagnation of the liver and stagnation of the liver on the lower jiao, and actually in the middle jiao a bit too, and this might influence the spleen and stomach here. But on the upper part, it's more loose and more weak. So I can connect it to the daimai meridian when it's too tight in a way, and I can connect it also to the some tense on the lower back or hips. I will check that. Tie-in shi means no excess. Shu is a deficiency. Okay, referring to the area in the circle, but different patient tongue has slight on the left side of the tongue. Well, it really depends. Okay. Any more questions? What about? Okay, I was here. If sound, it's not me. Okay, wait 1 more second. So I think this tongue picture is for metal imbalance. I have another one in the next formula. Okay, so it's all about sound. Let's go on. Okay, so contraindication, external wind invasion with fever, yin deficiency, use caution during pregnancy, sudden, okay. In condition that there's, yeah, well, external wind, well, it's caution, to be cautioned, but I don't take it so. The main thing that I'm thinking about is how to release the emotions. The other stuff, it doesn't. It's not that complicated with the herbs, because the herbs again they tend to warmth and to tonify chi. Okay, so it's always good. Warmth if there's a heat, so we might be cautious about it, but or fever, okay, the invasion of fever. But again, it's not that important in my opinion. Yupi Feng San, that will be the yin aspect of the metal. And we know this formula as tonifying the chi and stabilizing the exterior. The idea here is to keep the lungs, okay, to help the lungs. By the way, on the previous formula, in the past I used also Da Cheng Chitang. Da Cheng Chitang is one of the draining formulas, okay, or for some time I was using Hua Maren as one of the main herbs, just to release the large intestine, to release the blockage. But I saw that it's not working too much on the emotional aspects. That's why I changed it to this formula in order to bring the movement, okay, to the outside.